I mean, I hope we can appreciate and learn from your experience. So just as a first of questions, can you tell us in your words, what's the NHS net zero strategy?
I can. Thank you. Thank you for having me. My name's Nick. I speak Australian. I speak no French. I'm sorry. So I didn't hear Claudel introduce me, but I assume she said, this is my friend. His name is Nick. He is very, very intelligent. He is very, very funny. He is very good looking. He is very humble. I presume that is what she said. You can all tell me later. Yeah, more or less. Thank you. Thank you. Hi. What's the net zero strategy for the NHS? God. Well, first things first, there isn't one net zero strategy for the NHS. We are big, right? An organization of 1.4 million healthcare professionals, desperately, desperately screaming out to do more on climate change. There's a national strategy, report out about 12 months ago, boring, no one should read it. But behind that is where the magic is, right? Behind that is the delivery reports for our medicines team, for our nursing team, for our surgical team. Behind that are 237 local net zero reports, net zero strategies for each hospital, each trust, each integrated care system, which brings in primary care, brings in social care, brings in the broader public health considerations. Every single part of this system has its own net zero strategy. The idea is that they work together. We all come together, right? And so there are a couple of set pieces that we all work off. Number one, we've got an endpoint that we are interested in. That endpoint, 2040, for the emissions that we control directly. And I saw up in French a diagram that I obviously understood none of, but had some familiar pictures. So it talked about scope 1, scope 2, and scope 3. For the emissions we control directly, and I'll be very transparent here, net zero by 2040, that's scope 1 and scope 2. For the emissions that we know we can influence, scope 1, 2, and 3, 2045, and unclear what was there and often ambiguous. So when people are talking about this stuff, demand clarity. Scope 1, 2, and 3 of our international supply chain, not just the stuff that happens in the United Kingdom, the stuff that happens absolutely everywhere. Equally, when they say net zero, say, and what do you mean by net? Tell me about the offset, right? Never, ever let people get away with vague sort of things that sound a little bit too good to be true. The time for things that don't have angry numbers behind them is gone. That was a world we lived in the 90s, yeah? For the NHS, let's be clear, we intend to offset 6% of our direct emissions, 2040, 8% of our indirect emissions. We're gonna try as hard as we damn well can to make sure that we reduce that number. But I wanna be transparent because I think that's important. The other thing you should never let anyone do is set just a long-term target, 2040. God, I'll be dead by the time 2040 comes around. Also have short-term targets. And so 80% emission reduction by 2028 is what the NHS is aiming for. That is very soon. It's so soon that it makes me uncomfortable. It's so soon that it makes our board uncomfortable. So soon that it makes our chief executive uncomfortable. And that is how you know that it is going fast enough. So 2040 for the emissions we control directly, 2045 for the full profile. Now, Claudel, do you have other questions or do you want me to just keep talking through all the different stuff that we're looking at?
I know that you can talk for a while.
Exactly.
I guess one of the questions that we had is, how did you make that happen? How did you convince the NHS that this was needed? And how did you sort of move the political power to support you financially and politically in this? And as a bonus question, did you have the support from the staff to do this?
I didn't convince them, you did, right? This world has been building up strength and evidence and its voice for the last 3 decades. It has taken the form of passionate medical students, the International Federation of Medical Students Associations. It has taken the form of passionate junior doctors, nurses, pharmacists, groups like CAPE, groups like the UK Health Alliance on Climate Change in the United Kingdom, the Royal Colleges, the Canadian Medical Association, I know, enormously passionate God, there's more to do, but hey, they've shown up for the fight. It took the form of some really powerful evidence convened by some of the largest, most credible, most angry medical journals in the world, the Lancet, the British Medical Journal, the New England Journal of Medicine. These guys don't say things unless they damn mean it. It took Margaret Chan, the fifth horseman of the apocalypse, she called climate change back in 2008. Took the World Health Organization, it took all of us to get to the point where when the NHS turned around and said, oh my God, this climate change stuff, it's serious, isn't it? The entirety of the medical establishment, that core, crusty, slow, conservative part of the United Kingdom turned around and said, yes, for God's sake, yes. And so you were able to very quickly move from, okay, there's a question that's being asked, is it possible to develop a net zero strategy? There was an infrastructure in place, in this case, the Lancet Countdown, that was able to say, we can respond to that. We can tell you precisely what a net zero strategy has to look like for a health system like the NHS. Give us 9 months to be able to have something that was credible, right? The targets there, 2040, 2045, 2028, the 80% reduction target, they're not as quick as some people would like them to be. Some people think we need to go further, we need to go faster. I agree. The reason they are where they are is that is right at the limit of what we think we are able to do, what we feasibly, honestly believe we can deliver. We intend for those dates to come forward, but we weren't going to make it up. That's how the question started, right? We had a whole infrastructure out there to build on. How do you then convince someone, okay, well, this is going to be positive. Okay, this is going to be something that deserves investment. And to be clear, the investment of the NHS into this every single year is £310 million. That's going to go up next year to £500 million into climate smart healthcare. How? Because it's just good goddamn healthcare, right? Because a lot of this just pays back so quickly, because the transition, we're the third largest fleet in the country. We know that 36,000 people die every year from air pollution in this country. You're not a good healthcare system unless you are moving to a zero emission fleet. We know that our buildings are old. We know they need to be updated. We know our patients love it. We know they get better care. We know that they recover quicker when they are in a building, when they are in a hospital that is more appropriate for them. And so we invest in that. The return on investment, it pays for itself 3.5 years later. The final piece of this is, and I alluded to it very briefly, when we go and say, hey, what do you care about? So the NHS, 1.4 million healthcare professionals every year, every single year, we go out and we ask them, what are the things you want to see the NHS do more of? Every single year, they shout back at us, we want to see the NHS tackle climate change, act in a more environmentally sustainable way. I was really worried about what the answer to that question was going to be in 2021, because God, 2021's been a busy year, and you could be forgiven if you weren't focusing on something that was quite at that scale. The number didn't go down in 2021, it went up 2 percentage points higher. 92% of 1.4 million healthcare professionals across the country said, you know what my number one priority is? I want to see the NHS tackle climate change. It was a really special moment. That's how it happened, right? It happened because of all of the infrastructure. It happened to Claudel because of the work that you guys are doing over in Canada. It happened because 90%, 9 out of 10 staff want to make it happen.
Thanks, Nick. One of the questions that we've been asking ourselves, there's always a reason to push the discussion to later, especially while in a pandemic. I've seen highlights from headlines from UK about the shortage of family doctors and problem of access to healthcare, and we've been having similar discussion ongoing in Quebec about the lack of access to primary care, especially. So how do you bring that in all together, and why did you decide to launch in 2020, a few months after the pandemic hit? I remember, I think the first or sort of the official first press conference that you did was in October 2020. And I recall some discussion or whether or not this was a good timing or not. Do we make some noise about this? So can you just tell us a bit more behind the why you've decided to do it, despite the fact that there are, for some people more urgent and more urgent tasks to do in the healthcare system?
if someone thinks that if I ever hear that there's something more urgent or there is something we should focus our attention on that isn't climate change, I think my response is I haven't done my job very well. Because what I haven't done a very good job of doing is communicating the fact that you cannot recover from COVID unless you build sustainability into that. You'll just end up in the same situation with the same pandemic hitting you again 3 years later. You cannot deliver the core purpose of the NHS, first universal healthcare system in the entire world. The whole purpose is to deliver high quality care for all now and for future generations. By definition, you cannot do it unless you respond to climate change. Literally not possible. I think that's at the heart of it, right? Remembering that we're not really here, right? The people here on this call, we're health professionals, right? At some point, somewhere along the line, I showed up at a Foundations of Clinical Practice and a biomed lecture and a pharmacology lecture, and I showed up at, cardiology rounds. I'm here, we are here because it is good for patients. We're not here solely because it's good for polar bears, because it's good for trees. We're here because we know that the viability of our healthcare system, that the health of our patients depends on this response. And keeping that in mind again and again and again, never letting anyone ever forget that, I think is probably the critical moment, the critical thing you need to do. There was a discussion. So to tell the story, January 2020, the NHS announces its intentions to think through what a net zero healthcare system is. January 20, 2020, that happens. The 25th, 5 days later, the WHO declare a public health emergency of international concern. I turned around and I said, oh God, this pandemic looks serious. I suppose we should put this on hold. Maybe we can report in 2022. The response was pretty swift and pretty angry. What are you talking about, you idiot? The climate crisis is a health crisis. We can't afford to duck this problem as we deal with both. We're the NHS. If anyone can tackle two health crises at once, it is us, goddammit. This is what we trained for. The whole way through that period, from January to October, I kept saying, I'm really unsure about this, guys. Are you sure we have time to be able to do both? Are you sure? The entirety of the health service was reprioritizing, reorientating its capacity towards dealing with COVID. Two things, two parts of the NHS grew in 2020. One was an enormous part of the NHS that had to deal with COVID. It consumed huge amounts of resources, you can imagine. The other part of the NHS that grew in 2020 was the climate change team. We grew from a team of 4 people into a team of 140 people over the space of those 12 months. And again, when we came, you're exactly right, Claudel, in October, and I said, listen, are we sure we should be doing this? The response was, Nick, if we wait, there will only be another crisis. If we wait, we will miss this opportunity to transform the healthcare system. You told us, we believe you, we've read the evidence. The climate crisis is a health crisis. You can't afford to not.
You're 100% right. The last question I would have, because I heard you speak a little bit at COP26 that just happened, and we'll open the floor for some questions. But I just wanted to offer you the space to share with us the success that you've had in the last couple of months, and how much you've been able to measure the decrease in emissions that you've achieved in the last, I think it was the last 12 months.
Sure. The time for words is over, right? I've said that, I mean it. I'm pretty angry about it. I'm pretty sick of people talking and not doing. Maybe it's because I'm an Australian. So let's be clear, and when people don't have numbers, ask angry questions. Let me tell you our numbers. 12 months ago, we set a net zero strategy. The annual carbon reduction that we were aiming for was 1,260 kilotons of carbon, CO2e. Roughly the equivalent of 1.7 million flights from where I am here in London to Claudel. Whereabouts in the world are you?
Montreal. It's more or less the same distance as New York.
Almost. So 1.5 million. I worked it out. I had lots of time while I was sitting in an emergency department today. Roughly the equivalent of 1.1 million homes powered, right? That's what we were aiming for In the estate, we invested that £310 million into climate smart healthcare. We set a new net zero hospital standard. No new hospitals built in this country are going to be built to a standard that isn't at the level it needs to be. Again, full transparency, there's no such thing as a net zero hospital. The technology is not there yet. Give us 4.5 years. We think we can start doing it, but we're going to set that standard today and we're going to slowly increase. That reduced emissions by 256 kilotons. We installed new incentives for our pharmacy and primary care colleagues looking to tackle principally nitrous, principally a lot of the inhaler emissions, and for our anesthetic friends, a reduction down to 5% by volume use of desflurane, a particularly polluting medicine. We hit all of those targets, something we're really proud of. They're some of the lower hanging fruit, but God, I got sick of talking about it and wanted to see some damn action. That reduced emissions by 310 kilotons in the last 12 months. We shifted the contracts. We're the third largest fleet. Diesel, petrol, it doesn't have a role anymore in a modern healthcare system. You got to get rid of it. So we shifted our contracts. We expanded them out. We allowed providers to take the profits that they will see from an extended contract, reinvest that into a zero emission vehicle. That, combined with some innovations in rapid response vehicles and in ambulances, we created the world's first zero emission ambulance, two actually, an electric hydrogen hybrid for our rural populations. That resulted in 182 kilotons. All of those things, the things we're doing with our suppliers, we've been very angry, very clear. April 1st, 2027, 1 minute past midnight. If you are not publicly aligned with us, you will not be able to win a contract with the NHS. All 80,000 of our suppliers, all 62 billion pounds worth of procurement spend. Very clear, very angry. All of those things together got us to the point where we were able to say, and we are proud, cautious, but proud, that we hit our 1 year reduction target. The next year and the year after that gets harder, right? It's a steep curve down of decarbonization. It gets tougher year after year. You lose the low-hanging fruit. The key thing that happened at COP, Claudel, that gave me some hope was 12 months ago, there was only one national healthcare system in the world that had a net zero commitment. Over the 2 weeks of Glasgow, that changed. Suddenly there were 14 healthcare systems with net zero commitments. I promise you there are more to come. And it's that moment where this turns from a question of, oh, that's fun. The NHS is doing this. Maybe this is possible. I wonder. Maybe it's even positive. Who knows? To, for fuck's sake, this is inevitable. This is something that every healthcare system in the entire world is doing no matter what. The question doesn't become, that's interesting, well done, NHS. It becomes, hey, Canada, what are you doing? Why are you so slow? Australia, why are you so slow? Why haven't you got your act together? That's the really exciting part that gives me the assurance that we're going to be able to take on the next step and the step after that.
All right, I think that's, I mean, thank you. It's always not only a pleasure, but very informative and quite inspiring to hear you speak. And I've heard you speak quite for a while, for the last couple of years, but thank you, Nick, for everything that you've been doing, and especially for the incredible leadership that you've had. You've thanked us, medical students, junior doctors, and so on, but I think sometimes it requires a strong public figure that's able to speak with some people in power, and you have that ability to navigate between those two worlds. So thank you. I see the time goes by, and so I will just open the floor if there's just before we let you go and just let you get some rest. I'm just going to open the floor and see if there's some questions in the Q&A. Someone asked, what was the trigger for the 13 other countries to pay attention during Glasgow? I guess this is reference to Glasgow. What was the trigger? What did you find the most convincing argument to use? Can you let us know?
Oh, there's no one argument, is there? Isn't the problem? I mean, you know, Claudel, I should be asking you this question, right? You're one of the best communicators we have. But the problem is when we think that there's one message that will work with every population. You need all of them. You need to be able to talk to people about the environment and the impact it has. You need to be able to talk to them about childhood asthma. You need to be able to talk to them about biodiversity, about single-use plastics, about the financial savings. You have to be able to talk to them about how, hey, you don't want to fall behind the NHS. is a bit of competition, and this is the future of healthcare. This is what's going to define whether or not you are a good, competent anesthetist going forward. I think the one thing that probably did change is someone went and did something stupid, like say, hey, we're a big healthcare system and we're going to get to net zero. Previous to that, and I remember, in fact, November 2019, coming out of a meeting with the chief executive of the NHS and a couple of senior politicians in the UK, where they had come to the Lancet Countdown and said, listen, we want to bring the entire healthcare system to net zero. You would have the full resource you would require to do that. My head was spinning as I left that meeting, because back then no one knew what the hell that even looked like, right? You wouldn't believe the importance of someone taking their hat off, throwing it over the wall so that you have no choice but to follow over the wall to get your hat. I think that's important. And I think that's going to really be a shift where we're going to see, like I say, not 1, not 14, but 50, 60, Australia, where the hell are you, etc.
Thanks. I got a question from one of our ER doc lives and works in Quebec City, and he asked, he works a lot in sustainability, healthcare system sustainability, and he asked regarding this furan and anesthetic gas. He was asking if you can tell us a bit more about the NHS strategy, especially regarding nitrous oxide. And thanks you for your excellent conference.
Sure. So look, if it's an emergency physician who cares about sustainability and is asking questions about nitrous, they already know more about it than I do. A few things. Desflurane, a relatively simple shift, right? Desflurane, relatively simple because for the most part, there are good clinical equivalents. For the most part, modern anesthetic medicine moves away from volatile gases anyway. It moves towards total intravenous therapy, total intravenous anesthetics. The people that are holding on to it are the people that trained that way and are used to using it and don't want to let go of it. That's okay, right? We're gonna be on a journey here together, and it's going to take a little while. So we're not about angrily saying, listen, if this is something that you need a bit of help working through and training how to use different agents, then totally fine, right? This transition is going to be complex for us all. Nitrous is different. Nitrous is different, very, very roughly to explain the profile of nitrous within the NHS. 1/3 of the emissions we experience occur in maternity wards. 1/3 of the emissions occur in operating theatres, and 1/3 of the emissions occur either in an emergency department or in an ambulance somewhere out in the field. Very, very roughly by breakdown. Some of that stuff, easy to deal with. We actually did a little bit of an audit. There's a lot of leakage in a lot of the pipes, a lot of the manifolds, a lot of the pipes and the cylinders are quite old in the NHS. That stuff's simple to fix. Cost 10, 20, 30,000 pounds. We can find the problems trust by trust. And we're starting to do that. We can deal with a lot of those problems. A lot of our new hospitals won't have piped nitrous in them anymore. It's a drug that we don't think is strictly necessary there. When it comes to the emergency department, we're following the lead of Australia. Australia doesn't use a lot of nitrous. It's thought of as being a little bit out of date. It's thought of as being not particularly great for patient care. And so we are starting to look at a few different alternatives that you can use. The only time I really remember ever using nitrous was in a remote setting in Australia where I was relocating a shoulder, I think. Otherwise, remifentanil works incredibly well. That's something that a lot of the doctors there are trained in. Maternity wards is where it gets a little bit tricky, hey? There is a really interesting question about how you tackle some of that. Look, it is non-invasive. It is readily available. There are, however, things I think that we can do to tackle nitrous in maternity wards. Number one, let's make sure that the stuff is safe. Let's make sure that the ambient levels of nitrous in the atmosphere on the ward are at a safe level. And to be frank, the levels in the United Kingdom are much higher than is tolerable in Australia or across Western Europe. So that's the first thing we're going to do, is decrease the leakage and make sure we increase the harvesting. The second thing we're going to do is try to provide a mechanism for clinicians to have an engaged, informed conversation with their patients about the full profile, the full impact of some of those drugs. analgesia during labor is one of the best examples of shared decision-making that I can think of in medicine. And so it's one of the perfect places, I think, to start to have that conversation. Beyond that, we're going to stop, okay? Because we want to make sure that there is space for some of these complex things to come through.
And if I can allow, I will ask you one last question, just before letting you go. But there's someone in the chat who asked us if you could help us or guide us into what concretely, there's many health professionals in this conference right now that have diverse functions. Some are doctors, some of decision makers in healthcare healthcare institutions. What is one of or the few most effective actions that we could take on the local level to get that done, and especially linked to how we can influence potentially supply changes in our hospitals? There's obviously some complex regulations in Quebec as to, we call it la loi du plus bas soumissionnaire, but often the government will choose the cheapest option just because it's written in the law, so that sometimes doesn't help to get sustainable options. But so just as a final word, what can individuals do? Or what do you think is the most efficient action someone can take?
A technical clarification before I answer that question. Scope 3 emissions, right? That 2045 target for the NHS, it is misleading. Don't ever let anyone tell you or make you think that that is supply chain emissions and hence you don't have agency over it. Nonsense. Our chefs and our kitchen staff decide what goes on the menu, and our physiotherapists and our occupational therapists decide what walking aids they send their patients home with, and our nurses and our pharmacists and our doctors decide what medicines they prescribe to our patients. Yes, there are parts of the emissions, and the emissions are experienced outside of the four walls of a hospital, but we absolutely have agency over them beyond just what a procurement professional can control. And I need to keep reminding myself that, because if you're not careful, you go, oh, well, that's 62% of the NHS's emissions that are scope 3. We only deal with them by engaging with a pharmaceutical company. Nonsense. We deal with it by voting with our feet. To answer the question, 3 things. Number 1, have a conversation with one person that you haven't spoken to about this stuff. See if you can convince them that this is important. See if you can convince them to do one thing. If you can't, have a deep look at yourself in the mirror and try again, right? We need to get better at normalizing this, having these conversations, bringing it into just daily life, daily clinical practice. Number 2, go and ask a question. What's your hospital? What's your clinic doing about this? It's a really simple question. Send it to your CEO, figure out who they are and say, hey, I care about climate change. I'm a nurse, I'm a pharmacist, I'm a physiotherapist. I want to know what we're doing. And if they say nothing, then you can say, well, how can I help? If they say something, you can say, well, how can I help? But asking that question is important. You wouldn't believe the power of a question like that coming from a clinician. Number 3, have a conversation. Go and ask that question of your chief executive. Number 3, go and do something yourself. I don't care what it is. I don't care at all. Do not ask the question, what is the number 1 thing I can do? Go and do one thing. Do the one thing you will wake up tomorrow morning at 9 a.m. and do yourself, and then do it again and again and again and again, step by step, right? The NHS gets to net zero not because some bearded bureaucrat in London from Australia angrily says it should. It gets there because 1.4 million healthcare professionals make 1.4 million high quality, low carbon care decisions every single day. How's that?
That's perfect. That's a good, almost final word. Thank you, Nick, so much.